CSBG State Plan Webinar, Diving Deeper, Section 8 through 15. My name is Mitch Navetta, and I am a CSBG Program Specialist with the Division of Community Assistance. As you enter the webinar, please put in the chat one or two key takeaways you may have gotten from the previous webinars. During today's webinar, you will hear from members of the Division of Community Assistance Program Operations Branch as we go into a deeper dive of sections 8 through 15 of the FY26 CSBG State Plan. We will end the webinar with closing remarks and time for questions. Again, please be sure to ask all questions in the Q&A pod on Zoom. Reauthorized by the Community Services Block Grant Act in 1998, CSBG provides federal funds to states, territories, and tribes and tribal organizations for distribution to local community action agencies to support a wide range of community-based activities. Within OCS, the Division of Community Assistance partners with states, territories, tribes, and tribal organizations, communities, and community action agencies to eliminate the causes and conditions of poverty, revitalize communities, and increase self-sufficiency of individuals and families with low income. OCS remains dedicated to being partners and good stewards in ensuring CSBG funding reaches the most vulnerable communities and is utilized to implement community-driven anti-poverty strategies that create opportunities for upward economic mobility. With continued effort and a pulse on innovative and effective anti-poverty strategies, we can continue to assist individuals, families, and communities in reaching their fullest potential. The PEAK framework can serve as a visual reminder of the tools you have to assist you with the administration of CSBG. Within the PEAK framework, the state plan is listed under accountability and knowledge. However, aspects of the state plan are included across all areas: performance, evaluation, accountability, availability, and knowledge. For performance, the CSBG grant recipient should utilize the planning process to think through, identify, and define goals and expected outcomes that establish clear performance targets and align with the community needs assessment. The ACSI survey results, organizational standards, and training and technical assistance should contribute to the development of the state plan as well. A strong CSBG state plan should also ensure evaluation processes are informed by your training and technical assistance and how the eligible entities are performing as it relates to org standards, as well as monitoring outcomes. Submission of the state plan is part of accountability, requiring that you comply with the CSBG Act to receive funding and demonstrate that systems are in place at the state level to responsibly steward these resources. The state plan is key to ensuring the availability of CSBG services for individuals and families navigating poverty. And finally, the state plan addresses knowledge, ensuring CSBG administrators are aware of the needs and resources available, such as partnerships within their state, in order to make data-driven decisions on the most impactful uses of CSBG. State administrators should be well-versed in available guidance and learn from best practices to successfully administer CSBG. Grounding in the CSBG Act, the submission of a CSBG state application and plan is a requirement for eligibility under Section 676B of the Act. The state plan serves as an application for CSBG funding and a roadmap detailing how each state will administer CSBG funds in support of meeting the three national program priorities: to first, eliminate the causes and conditions of poverty; second, empower low-income families and individuals to become self-sufficient; and three, revitalize low-income communities. Completing the state plan is not just a legislative requirement. It serves as a tool for continuous quality improvement and the implementation of important processes that ensure CSBG funds are successfully administered. All fiscal year 26 CSBG state plans are due by September 1st, 2025. Please note this is a federal holiday, so please plan accordingly. I see someone in the chat also pointed that out already, so they get the A+. The state plan is based on the federal fiscal year, which goes from October 1st through September 30th. Grant recipients have the option to submit a CSBG state plan that covers one federal fiscal year or two consecutive federal fiscal years. For this submission, a one-year plan would cover FY26, which is October 1st, 2025 through September 30th, 2026, and a two-year plan would cover that fiscal year 26 through September 30th, 2027 in fiscal year 27. The key components of a complete CSBG state plan submission include the following: the CSBG eligible entity list, the standard form for federal assistance, also known as the SF424M, sections 1 through 14 of the CSBG state plan, including an up-to-date designation letter, and the federal certifications, which are section 15 of the state plan. As a reminder, the CSBG state plan is subject to all requirements of the CSBG Act, including the public hearing requirement. After submitting by September 1st, 2025, DCA will work quickly to provide thorough feedback. So, the states in maroon are those listed in Group A in the action transmittal, which is also going to be linked in the chat. These states are required to submit a complete CSBG state plan for the fiscal year 26 CSBG state plan cycle. OCS strongly encourages all CSBG grant recipients who are developing applications and plans for FY26 to ensure that intended plans, services, strategies, and expenditures funded under CSBG, including those made by subrecipients or contractors, are aligned with the Secretary's directive and do not support diversity, equity, and inclusion, or DEI initiatives, or any other initiatives that discriminate on the basis of race, color, religion, sex, national origin, or any other protected characteristic. The states in teal are Group B in the action transmittal and are not required to submit a complete CSBG state plan for FY26. The listed states and territories under Group B may still revise their previously accepted plans. Please note that the action transmittal asks grant recipients with accepted two-year plans ending September 30th, 2026, to review and revise accepted plans as needed to ensure they are consistent with the executive orders and the secretarial directive on DEI-related funding. As prescribed by the directive, plans and activities cannot support DEI initiatives or any other initiatives that discriminate on the basis of race, color, religion, sex, national origin, or another protected characteristic. The CSBG grant recipients with previously accepted two-year plans must submit any revised plans or notify OCS that no revision is necessary by November 3rd, 2025. Revised plans are subject to the requirements of submitting a full plan, including having a public inspection and the authorized official certifying the report. So again, a complete CSBG state plan includes the CSBG eligible entity list, the SF424M, and sections 1 through 15. In today's webinar, we will be reviewing sections 8 through 15 of the CSBG state plan. We encourage you to take notes as we present each section and open the state plan PDF tool so you can complete sections as we go. Let's begin with section 8. The purpose of section 8, State Training and Technical Assistance, is to describe the state's plan for delivering CSBG-funded TNTA to eligible entities. It includes the TNTA schedule for Year 1 and Year 2, if applicable, the planned budget, notification of any existing technical assistance plans or TAPs, and any performance management adjustments. Planning for Section 8 should reflect the needs of the eligible entities to successfully and efficiently administer CSBG. It is important to use knowledge from the annual reports, direct feedback from eligible entities and state associations, and any observed challenges when determining what this TNTA schedule should look like. Providing a thorough outline of the state TNTA plan will also allow the federal government to see where need is greatest and helps determine where to focus federal TTA efforts. The TNTA plan in item 8.1 is also carried over into the CSBG Annual Report, Module 1. For this reason, it is important to plan with intention and to learn from the shift in need between the development of the previous plan and the reporting of what actually happened. Use what is learned to better prepare for the years to come. Lastly, this section opens the door to meaningful collaboration around TNTA with your state association and regional performance and innovation consortia, also known as the RPICs. State associations and the RPICs are engaged in the coordination of state and regional specific TNTA for CSBG lead agencies and eligible entities. Both can support activities like the distribution of the state TNTA needs assessment to eligible entities, the provision of trainings on topics listed in the Section 8 table, and the coordination of larger scale efforts to engage across the state or region. Together, this partnership can strengthen TNTA and make an impact in addressing the needs of your local network. Let's lean into meaningful collaboration even more. OCS wants to emphasize that there are cooperative agreements in place with national and regional partners to provide TNTA to the network. The cooperative agreements include the Regional Performance and Innovation Consortium, or RPIC. There are RPICs in each region, with 2 in Region 4, and they tailor TNTA opportunities specific to their region. The Collaborative on Economic Mobility with the National Community Action Partnership, or NCAP. They have recently completed a webinar series, for example, on innovative approaches to workforce development and building and sustaining strategic partnerships. The Performance Management, Alignment, Training and Technical Assistance Cooperative Agreement with the National Association of State Community Services Programs, or NASCASP, who recently supported a new training e-course on the CSBG Annual Report. And finally, the Legal Training and Technical Assistance Cooperative Agreement with Community Action Program Legal Services, or CAPLAW, who recently provided a resource guide to grant recipients and eligible entities for updates to HHS's adoption of uniform guidance that will go into effect this October. The partners work to increase capacity for CSBG grant recipients, eligible entities, and partners. Item 8.4 requests that grant recipients describe any adjustments made to the TNTA plan from the previous submission. It is crucial to be aware of shifting TNTA needs across your local network. Item 8.4 is an opportunity to evaluate the evolving needs of the network and to utilize feedback to ensure the TNTA provided is intentional and impactful. When looking to adapt TNTA, there are several supports available. One such support can be found, again, through the CSBG state associations and RPICs. State associations and RPICs conduct regular needs assessment surveys of the eligible entities in their locality, which can aid in the planning for future TNTA. Let's take an opportunity here to engage in peer-to-peer support. In the chat, what are some highly requested trainings you've seen from the network? How have you used state funds to meet those needs? This relates, of course, to Section 8 that we just went over. And I'll repeat, what are some highly requested trainings you've seen from the network? And how have you used state funds to meet those needs? I'll let people type in the chat for a second. We have someone saying that they've seen highly requested trainings around org standards. That's always a perennial topic. Roma, also a common one. Board roles, that also makes sense for the local eligible entities. Um, we'll move on to Section 9, but if you still have some examples of highly requested trainings, please feel free to put those in the chat. The purpose of Section 9 is to detail the state-level linkages and coordination that the state intends to create or maintain to ensure access to CSBG services for individuals, families, and communities with low income. In these responses in Section 9, OCS wants to know, how does the CSBG network partner with communities and other anti-poverty programs to provide the best opportunities possible? How does the state office meaningfully collaborate with their own government, their local network of CAAs, and organizations across the community to ensure high quality, innovative, and locally driven services are available to individuals and families living in poverty? These collaborations are not always through a contract for services or involve an MOU. We want to see any actively pursued linkages and collaborative efforts meant to improve services. Section 676B of the CSBG Act requires an assurance that states will coordinate and establish linkages with other government and social services programs. As noted in the Act, the coordination and linkages with other programs and agencies are important for ensuring the effective delivery of assistance to the populations served by CSBG. By braiding and blending funding, not only are states performing more efficiently, they are also providing better wraparound service to the individuals and families who need help. These linkages are also vital to preventing duplication of efforts. Within the plan, states can share how they are establishing and maintaining linkages with other governmental organizations, social services, and anti-poverty programs to effectively coordinate and deliver CSBG-funded services to low-income individuals, families, and communities. Linkages with local workforce investment boards, homeless continuum of care coalitions, disaster recovery resource centers, social services departments, centralized service centers, community health and child care centers, faith-based organizations, educational institutions, and other community-based organizations promote service coordination and comprehensive service delivery at the local level. Linkages also allow organizations to improve performance, increase availability to services, and further tell the story of CSBG. Linkages allow for organizations to identify where gaps in serving their local communities exist and what partnerships may be leveraged to help address those gaps. Leveraging partnerships also ensures a more streamlined approach for families and individuals trying to access services, because if the family needs a service that the CAA does not provide, the agency could refer them to a partner that does offer that service. In items 9.2 and 9.3, OCS notes that state linkages and coordination at the local level should include how the state is encouraging partnerships and collaboration with public and private sector organizations to assure effectiveness and to provide the best opportunities to the individuals, families, and communities that CSBG serves. The linkages and coordination efforts of the state and eligible entities should be intentional, based on the needs of the local community, and include the active participation of the state lead agency or the eligible entity in planning and implementation. Some examples from how the federal government engages in linkages and coordination are things like our collaboration with the Department of Labor and the Workforce Innovation and Opportunity Act, or WIOA, to ensure CSBG is brought to the table for workforce innovations. Our combined outreach and collaboration with the Office of Head Start to ensure high-quality child development and education services and work opportunities are available to families, and working with the Office of Family Assistance to support programs that strengthen the safety net for clients served. These efforts often do not include a contract, but they make a difference in the services and opportunities available to the network. While these are across the federal network, there are the same opportunities for the states to engage in similar types of coordination at the state level. So now, share with us in the chat. What are some strong partnerships you have seen in your state, at the state level and at the local level? For example, at the state level, you may partner with the LIHEAP lead agency in your state, housing authorities, TANF or temporary assistance for needy families, Head Start, and other workforce programs. At the local level, entities may partner with faith-based organizations, homeless services, food pantries, or nearby tribes and tribal organizations. So in the chat, if you've seen strong partnerships in your state at the state or local level, please feel free to share that with us. And I'll let folks think about that as we move into the next slide. One example of state-level coordination and linkage is through WIOA, the Workforce Innovation and Opportunity Act. The CSBG network is a natural and important partner within the workforce system and has a long history of collaborating with public and private workforce partners to better support the needs of people living in high poverty areas. CSBG is incorporated into WIOA in two significant ways, as a required one-stop partner or as an optional combined state plan partner program. Under WIOA, CSBG is a required one-stop partner if the state uses CSBG funds for employment and training services. More specifically, if an eligible entity carries out employment and training activities, then these activities must be accessible at the comprehensive one-stop centers, either through a physical presence or another means of access. The state also has the option to include CSBG as a combined state plan partner program, which requires the CSBG office to be meaningfully included in the strategic planning and coordination with the state board, the core programs, and any other partner programs. While both require the state to include CSBG in the common elements of the WIOA state plan, participation as a combined state plan partner program requires more thoughtful integration across the common elements, as well as completion of a CSBG-specific portion of the WIOA combined state plan. Further, a state that has a combined state plan does not always select CSBG to be a combined state plan partner. With this knowledge, to answer the question in item 9.4, you should only select yes if you are a combined state plan partner program in the state's WIOA combined state plan. This means you assisted in completing a separate, designated section for CSBG in the WIOA combined state plan. If you are not a combined state plan partner program, select no. If you select no and are still a required one-stop partner, noting that many CSBG eligible entities are engaged with local workforce partners and American job centers, select no and complete the narrative for 9.4b regarding the employment and training activities and a description of how CSBG partners with the workforce system. This may include a reference to Memoranda of Understanding, or MOUs. There are only a few states who should be answering yes for this item, but many states should be sharing their participation as a required one-stop partner. If you are unsure, please ask your assigned program specialist. The only states that are currently considered combined state plan partner programs are Florida, Georgia, Louisiana, Maryland, Missouri, Oregon, Pennsylvania, Tennessee, Washington, and West Virginia. Let's also look more closely at item 9.9. Item 9.9 provides the opportunity for the state to describe how you will communicate with eligible entities, state associations, and other partners regarding the main requirements under CSBG. To foster strong linkages and effective coordination, as well as to engage in continuous quality improvement, clear and consistent communication with established partners is necessary. This section allows the grant recipient to set standards for effective and clear communication and, in turn, strengthen partnerships. Continuing the focus on communication, item 9.11 asks the state to describe any adjustments made to the communication plan based on an analysis of past performance and feedback from stakeholders. Now, in the chat, please share with us, if applicable, what actions will you take to improve your communication efforts? What actions have you taken in the past to improve communication efforts? I'll pause so that folks can type out some answers in the chat. But again, this is about item 9.11 and communication. What actions will you take to improve your communication efforts going forward? And what actions have you already taken previously to improve communication efforts for CSBG? As folks think of their responses, I'm going to now pass it on to my colleague Renee Brooks to take us through the remaining sections of the CSBG state plan. Renee?
Thank you, Mitch. Hi, everyone. My name is Renee Brooks, and I am a program specialist with DCA. I'm going to bring us right into Section 10, Monitoring Corrective Action and Fiscal Controls. So the purpose of Section 10 is to describe the planned monitoring of eligible entities and the associated procedures and policies. This section covers 4 areas: the general monitoring process and calendar, the policies and procedures for corrective action, termination, and reduction of funding, policies on eligible entity designation, de-designation, and redesignation, and fiscal controls and audits and cooperation assurances. A reminder that the monitoring of eligible entities, including corrective action and the state policies that ensure these activities are properly conducted, is key to ensuring CSBG funds are used appropriately and that CSBG funds and programming are addressing specific needs within communities being served. We encourage state grant recipients to ensure policies and procedures are thorough and comprehensive and that corrective actions are made available to address any issues that arise during monitoring. We want to briefly remind grant recipients that OCS conducts standard monitoring reviews as required under Section 678BC. These monitoring reviews follow a standard protocol that addresses the administrative, programmatic, and fiscal compliance with CSBG Act requirements. So why look at OCS monitoring? All the fiscal, programmatic, and administrative elements of the state plan and annual reports are included in OCS monitoring. Reviewing OCS monitoring protocols can assist state lead agencies in conducting a self-assessment when completing state plans. In item 10.1, the state will be asked to outline their monitoring schedule during which the state reviews eligible entities. While completing this schedule, it is important to remember that Section 678BA of the CSBG Act requires a full on-site monitoring review of an entity at least once every 3 years, an on-site review of each newly designated entity immediately after the completion of the first year receiving funds, follow-up reviews including prompt return visits to eligible entities that failed to meet the goals, standards, and requirements established by the state. Other reviews as appropriate, including reviews of entities with programs that have had other federal, state, or local grants terminated for cause. Part of OCS's role as responsible stewards of CSBG is to review TNTA and corrective action procedures employed by state lead agencies. Items 10.5 and 10.6 request additional information on entities who may be on quality improvement plans, or also known as QIPs. We request this information to support states in identifying and addressing issues in a way that increases the capacity of entities through targeted TNTA and in turn ensures effective service delivery. We encourage states to develop robust policies and procedures for providing TNTA to entities on QIPs. It is crucial, especially in a situation where the state expects potential de-designation, that they maintain records of correspondence, communications, and all TNTA provided related to an enforcement action. We also encourage states to consider how they can utilize existing TNTA assistance throughout our national partners, RPICs, and state associations in support of an entity on a QIP. Lastly, it is crucial that the state notify the assigned program specialist when an entity is placed on a QIP for awareness and to allow the federal office to provide support during the process. Now let's discuss the policies and process of eligible entity designation. Item 10.8, redesignation, item 10.9, and de-designation, item 10.10. These items describe the process for designating new entities, redesignating existing ones, and de-designating entities when necessary. It is important that state grant recipients take time to clarify state regulations, policies, and/or procedures regarding these processes, and that this information is readily available. Clear designation processes ensure high-performing entities enhance fund usage, regular assessments identify inefficiencies, and transparent procedures uphold integrity. Most importantly, if your state does not have policies and procedures, this section represents an opportunity to develop policies and procedures for these actions. Lead agencies should ensure that their state policies and procedures are in line with Section 676A of the CSBG Act and IM 116, the corrective action, termination, and reduction of funding. The federal government can assist in providing clarity around these processes and assist in ensuring all requirements under the CSBG Act and IM 116 are met. As always, please contact your assigned program specialist as early as possible if you think a de-designation or redesignation is likely to occur. All right, on to an activity. I'm going to launch a poll question, and the question is, in accordance with Section 45 CFR, Section 96.92, an eligible entity has how many days following the final notification to reduce or terminate funding for the state to request a review for the Secretary of HHS? And I'm launching the poll now. And we have A, 60 days following notification. B, it varies by state. C, 30 days following notification. And then D, eligible entities cannot request a review. And I'll allow a minute or two for y'all to complete the poll. Ooh, we're split between two, y'all. They're fighting each other. We still have some people to complete the poll, so I'll wait a minute or two more. All right. I think we're at a lull, so I'll end the poll. And the correct answer is actually C. 45 CFR sections 96-92 says that the entity may request a review in writing within 30 days of notification by the state of its final decision to terminate funding. For this reason, it is essential that grant recipients develop and adhere to strong procedures for monitoring, corrective action, de-designation, and documentation. So the correct answer is C. Thank y'all for participating. All right, so moving on to section 11. The purpose of Section 11, Eligible Entity Tripartite Boards, is to review the eligible entity tripartite board requirements, including tripartite board verifications and what measures are taken to ensure states verify eligible entities are meeting board requirements, how often lead agencies require eligible entities to update tripartite boards, and what methods are used to ensure compliance, a description of how a state verifies that eligible entities have policies and procedures in place by which individuals or organizations can petition for adequate representation on an eligible entity's tripartite board as required by the Section 676B10 of the CSBG Act, and if the state permits public agencies to use an alternative to tripartite boards as allowed in Section 676B B2 in the CSBG Act. For more details, please see Section 678B of the CSBG Act and CSBG IM 82. Section 676B of the CSBG Act requires that, as a condition of designation as an eligible entity, private nonprofit entities and public organizations administer their CSBG program through tripartite boards that fully participate in the development, planning, implementation, and evaluation of programs to serve low-income communities. More specifically, a tripartite board is required to be composed of 1/3 elected public officials or their representatives, at least 1/3 representatives of low-income families and individuals in the neighborhood served, and the remainder consist of members of groups and interests in the community served, such as leaders of business, industry, labor, religious organizations, law enforcement, education, social welfare, and other major groups and interests of the community. Board composition can significantly affect how well and to whom eligible entities administer services. An optimal board composition for CAAs is one that accurately represents the interest of the community and includes individuals with a variety of background and skills. I want to give everyone a moment to share in the chat what methods your state or territory is using to ensure CSBG eligible entities are meeting tripartite board requirements. And I'll allow a minute or two for y'all to think and share in the chat for some peer-to-peer engagement. And I'll just repeat the question. I want to give you a moment to share in the chat what methods or your state or territory is using to ensure CSBG eligible entities are meeting tripartite board requirements. Ooh. So we have collecting board roster, attending board meetings, during monitoring. Another individual said monitoring. And then while others are thinking, I'll go ahead and move on to the next slide. Thank you for sharing. The tripartite board is a key component of community action and is explicitly outlined in the CSBG Act to encourage maximum feasible participation. It is crucial that the state supports eligible entities in ensuring the tripartite boards maintain adequate representation from their communities. As such, CSBG state lead agencies should be aware of prolonged tripartite board vacancies and work closely with eligible entities to course correct to ensure maximum feasible participation. All right, and now we're moving on to section 12. And the purpose of Section 12 is for the state to identify the income eligibility threshold and practices for ensuring adherence by eligible entities. As such, the state must answer two questions. Keeping the federal poverty level in mind, what level will be used as a threshold to determine eligibility? And does the state have policies and procedures related to the determination of eligibility for individuals and family services, general and short-term services, and community-targeted services? Across the questions, the state must also consider how they will determine eligibility in situations where individual or household determinations may be difficult. As a reminder, Section 6732 of the CSBG Act says that a state may elect to set the threshold at no greater than 125% of the federal poverty line, as set by the Department of Health and Human Services. The Federal poverty levels have been updated and released for 2025 by the HHS Office of Assistant Secretary for Planning and Evaluation, or ASPE. States are required to use the most updated levels for the given year. The chart showing the different multiples of the 2025 poverty guidelines is linked in the chat. In recent years, states have had the option to set the threshold up to 125% as established in the CSBG Act, or up to 200%, the limit allowed through congressional action under the continuing resolution. Now, this is possible because starting in federal fiscal year 2020, in response to the onset of the COVID-19 pandemic, the CARES Act allowed states to increase the income eligibility threshold for CSBG up to 200% of the federal poverty level. This change has remained in effect since then and remains an option until modified by congressional action. When considering the FPL level for your state, think about your population, specifically those who are living in poverty. Would it be feasible to serve at the higher 200% FPL level or to serve on the lower 125% level? For example, if other programs in your state use a threshold of 125%, then you may want to consider aligning CSBG accordingly. Regardless, in Section 12, states should consider adopting language stating that your state will set the income eligibility threshold up to 125% of the federal poverty level unless authorized to use up to the 200% limit under congressional action. Should congressional action remove the ability to use the 200% FPL ceiling, states may be required to amend their state plan if they enter a level above 125%. Wording indicating this flexibility would prevent the need for a state plan amendment in the future. On the following slide, we see 5 things to consider when thinking about how determining income eligibility is part of the state's anti-poverty strategy. The eligibility threshold is the gateway to CSBG services. Setting it carefully helps ensure the anti-poverty strategies are available and efficient and purposeful. Thoughtfully setting the threshold helps prevent the exclusion of your plan from serving both those most in need as well as a person who may be working low-pay jobs who may not meet the lowest income cutoffs but still struggle financially. Does the state want to target those most in need? How does the state intend to leverage other resources to maximize impact? And will the efforts require alignment of eligibility requirements? How does the threshold support comprehensive, long-term solutions which hopefully prevent benefits cliffs? As you can see, establishing the threshold is not just about a percentage, but rather a pathway. Here you see sample footnote language from a Notice of Award for the fiscal year 2025 Quarter 2 funding release. This language in your NOA authorizes the use of the 200% FPL limit until a specific date or congressional action. And now on to Section 13. So the purpose of Section 13, Results-Oriented Management and Accountability, the ROMA system, is to collect information regarding the performance management system used to support state and eligibility accountability as required under Section 678EA of the CSBG Act, and to collect information related to assurances under Section 676B12 regarding performance management systems and Section 676B11 regarding community action plans and assessments. Items 13.1 through 13.4 pertain to the assurance under 676B12 that the state will assure the state and eligible entities will participate in ROMA or another performance management system and will describe the outcome measures used to measure eligible entity performance. And then items 13.5 and 13.6 pertain to the assurance under 676B11 that the state will secure a community action plan, which will include a community needs assessment from each eligible entity in the state as a condition for receipt of funding. Beyond an explicit requirement under the CSBG Act, both categories of assurances are important to the administering of the grant as they will help ensure the grant recipient has engaged thoughtfully in developing their performance management system and ensure there is a clear process for the development of community action plans and implementation of community needs assessments, all of which will ensure the provisions of services are in line with the community needs. Please see IM 144 regarding state and federal accountability measures and data collection modernization, and IM 138 regarding state establishment of organization standards for eligible entities for more detail. Now, looking more closely at Section 676B12, the state must assure that they and all eligible entities participate in one of the three options: the ROMA system, another performance measurement system for which the secretary facilitated the development, or an alternative system for measuring performance and promoting self-sufficiency, family stability, and community revitalization. The alternative systems must meet the requirements of Section 678EB of the CSBG Act to measure the performance of states and eligible entities and carrying out the requirements of the CSBG Act and achieving the goals of their community action plans. The details of chosen performance measurement system should be more clearly laid out in response to items 13.1 through 13.4 and includes how the state will support the eligible entities in using ROMA or an alternative performance management system as well. When choosing a performance management system, it is important to consider the needs of your state's network and how ROMA or another model for continuous improvement may fit. All right, so it's time for another activity, time for a pop quiz, and this one is a true or false question. And I will go ahead and launch. All right, so ROMA is the only acceptable performance measurement system. True or false? I said the answer in the previous slide, so let's see who was listening. All right, there are still people completing the poll, so I'll do a few more seconds. A few more seconds because half of the attendees have responded. All righty. I'm going to go ahead and end the poll. And the correct answer is false. As noted in the previous slides, there are other options for the grant recipient to utilize an alternative performance management system. All right. So the purpose of Section 14 is to describe how the state will guarantee or assure that CSBG funds will be used to carry out required activities. So more specifically, Section 14 includes narrative responses for the assurances required under Section 676B of the CSBG Act. These assurances refer to use of funds to support local activities, specifically for CSBG services, needs of youth, and coordination of other programs, state use of discretionary funds, eligible entity service delivery, coordination and innovation, eligible entity emergency food and nutrition services, state and eligible entity coordination and linkages, federal investigations, funding reduction or termination, coordination with faith-based organizations, charitable groups, community organizations, eligible entity tripartite board representation, eligible entity community action plans and community needs assessments, and state and eligible entity performance measurement. Some items under Section 14 do not require a narrative response and instead refer to a previously completed section. The final item is a checkbox to confirm that CSBG authorized official has certified the assurances. This must be selected by the authorized official. And now moving on to the final section, Section 15. So the purpose of the final section, which is the federal certification section, is for the state to verify or acknowledge that CSBG funds will not be used to carry out prohibited activities and the reporting of such activities. These certifications include the topics of lobbying, drug-free workplace requirements, debarment, suspension, and other responsibility matters, and environmental tobacco smoke. In Section 15, by selecting the checkboxes, the authorized official is ensuring compliance with these different topics on the part of the grant recipient. Again, the authorized official must check the box after each certification. All right, so before we wrap up, I want to make a few notes about the Online Data Collection System, or OLDC, which is where you will complete and submit your CSBG state plan. At least 2 people from your office will most likely need OLDC access if they do not have it already. And these people are the person who will complete the state plan and the authorized official who will certify and submit it. If you need help troubleshooting with OLDC, please reach out to the Policy Data and Evaluation branch using the contact information that will be dropped in the link. You will want to also copy your assigned program specialist and your data and evaluation specialist to ensure a timely response. Each region is assigned a program specialist and data and evaluation specialist. For targeted and general technical assistance, please reach out to your assigned program specialist and copy the policy, data, and evaluation specialist. We work closely as a team and request that you include both contacts in any outreach. You can find your regional contacts on the page shared in the chat. If you are having issues with your OLDC account, please contact the Grant Solutions Help Desk and copy both your program specialist and PD specialist.